Today, we're going to talk about physical therapy and its use with CRPS. Physical therapy can be done in a variety of ways. It is not limited to working with a physical therapist directly. There are things that you can do at home, such as range of motion. If you don't use it, you will lose it, meaning you will lose function. I learned this in nursing school, and if I did nothing else in the day, I did range of motion of my foot and ankle. So if I had a wrist or hand injury, I would move my wrist and my hand through different positions to keep it moving. Water therapy. This can be done by a physical therapist or on your own. It reduces the wear and tear on your joints, and water allows you to move body parts that you may not be able to move on land. Water therapy can be as simple as walking in the pool. The old adage, no pain, no gain, does not apply to CRPS. You do not push yourself through the pain. If you do a formal physical therapy, you need to use a physical therapist that has worked with a lot of patients with CRPS. My first CRPS doctor advised me not to have physical therapy because so many of his patients were injured further with physical therapy. However, I'd already done physical therapy through a chronic pain program, and that's where I was diagnosed. They were very familiar with CRPS. We did a combination of water therapy, physical therapy, occupational therapy, group therapy, individual therapy, and biofeedback. For me, it was a good experience. One of the goals was to get me to be able to stand longer. So they would give me a task, such as working on a puzzle or basket weaving, that I would do from a standing position to work on increasing my ability to stand. There are different types of therapists. Occupational therapists have a master's degree. They create goals, make a treatment plan, and track the person's progress. An occupational assistant therapist does not have a master's, and in many places they carry out the plan of the occupational therapist. A physical therapist has a master's degree. They take measurements, set goals, make up a treatment plan, and track the patient's progress. So if my injury was at the elbow and I could not extend my arm, they would take the measurements between my forearm and upper arm. And as we worked, they would expect you to be able to increase that angle. Another great way to do physical therapy is in combination with ketamine. One provider has his physical therapist doing range of motion on the affected limb during the ketamine infusion, and more active physical therapy either before or after the infusion. Alana will talk to us a little bit about her physical therapy experience with ketamine. In many articles, and I will put the link to this one in the comments, it's been shown that exercise can lessen the pain of CRPS. The sooner that rehabilitation is started, the better the outcome. In my time frame, most of us were not diagnosed early on. although I'm starting to see a shift of more people being diagnosed sooner. By the time of our diagnosis, many have lost function of the affected limb. Mirror therapy is often used. It's what it sounds like. A mirror is upright. The affected limb is on the non-mirror side, and the unaffected limb is on the mirror side. And it tricks the brain into thinking that the affected limb is fine. This was originally used with amputation patients. In women with pain and edema in one limb, range of motion therapy decreased the pain and decreased the swelling, according to the articles. So I just talked a little bit about mirror therapy, but we'll talk a little more. As I said, it was first used with amputees. It is designed to trick the patient's brain while directly and transforming it in their mind. It's kind of like our brains are telling us that we're always in pain and they're always sending pain signals, even though there really isn't a pain. This kind of works in reverse. The mirrors help deceive them into thinking that they are not experiencing pain through dynamic feedback to their brains. The normal limb is put next to the mirror, making it appear as if it is the opposite limb. This would not be effective in someone who had CRPS in both limbs. RSDSA, which is a nonprofit, has a guide to physical therapy for someone with CRPS. Again, I will put the link in the comment section. So next we will have Alana talk to us about her physical therapy experience. Hi, I have Alana with me today, and she is going to talk to you about her treatment with both ketamine and physical therapy. You chose ketamine along with your physical therapy. Explain why this is a really good treatment option.
I actually didn't choose it. It was by accident chosen for me.
Okay.
Where I did my ketamine treatment, they
Mhm.
provided physical therapy before treatment. And because of where I live, which is Toronto, Canada,
Mhm.
there's very minimal help here in Canada for me. So I took full advantage of the physical therapy provided for me with the ketamine treatment. And I did it a half an hour before treatment. And then while I was getting the infusions, a physical therapist came to my room and performed physical therapy while I was under because I am not desensitized.
Right.
So that helped me it, huge amounts.
That's awesome. Did you have high dose or low dose ketamine?
I know.
Okay. And how do you think that the ketamine helped you through the physical therapy process?
Because I was sedated, I didn't feel people touching my leg, so it allowed people to work on my leg and get movement in my foot and my ankle and my toes and my upper leg where I was not moving my leg at all. So it it caused my like I it caused my ankle. I have dystonia and allodonia, but where I started 9 years ago, where my foot is was completely turned in, I am now 9 years later almost flat on my foot
That's
from
awesome.
Yeah.
Well, one of the drawbacks of physical therapy can be injury.
Yes.
So you couldn't give them feedback, but even if something were to have caused something, you're already getting the ketamine, so it should knock each other out. Um,
Right.
Go ahead.
The physical therapist did ask me every day, did I feel pain from the day before? Sometimes I would. So thank God, the physical therapist who I am still dealing with, knows CRPS very well,
Right.
is not into injuring me or pushing me further than my body is able to go. And so he's very aware of my body and the condition.
That's awesome. It's actually very important to have a physical therapist who has worked with other CRPS patients because the no pain, no gain does not apply to us.
Absolutely.
Are you still getting ketamine now?
I am.
How often?
I travel every 2.5 to 3 months
Okay.
to get.
All right. And is the ketamine still helping you?
It's the only thing that helps.
Yeah, I tend to feel the same way.
Yeah.
Anything else you'd like to share with us about your combination therapy?
I do know I started this a long time, Nancy, and I know a lot of people aren't into the physical therapy part. They are afraid of injury, or they feel that a lot of people don't know much about it, or afraid of getting injured or not helping. Um, I heard a lot of those comments, and I still, um, I asked the doctors. I believe the clinic I go to.
Yeah.
So I believe the physical therapy
I
department,
don't. He
and
never sent me to physical therapy there.
so when it's, that's funny because I remember kind of the time when you were around there and other people were, and he provided the physical therapy a half hour before, and I kind of stopped for a few years, and then I went back 3 years ago. And since I've been going back since the 3 years, I can't believe how far my foot has come. And even though I still have the dystonia and allodonia, I'm walking so much better. And I think if people either ask their doctors if they know somebody that does physical therapy with specifically CRPS patients, because I know from here, you can tell when somebody doesn't know
Oh, yeah.
what they're doing and when it's time to leave. But I believe it really does help. And
It really is the best combination. I probably didn't get physical therapy because as a nurse, I knew if you don't use it, you lose it.
yes,
So from day one, I've always done range of motion and
yeah.
strengthening exercises. So it was probably felt that that would be unnecessary for me.
Well, then you were already doing it. Like for me, I came from no knowledge, no background, no help here. So
And actually, the before I was even diagnosed, I was recommended to do an outpatient chronic pain program, which did incorporate, and I did not yet have a diagnosis. And there were a couple things they did that caused an injury other than where my CRPS was. But,
yes,
I was able to say, okay, when you
yeah,
did this, that's what happened. So let's not do that again.
again,
They were
yeah,
fine with it.
yeah. Yeah, it's really important for us as CRPS people to know when to say no, but also to give other things a try, um, because all of our cases are different, and what might work for me might not work for you. But it really is. I'm open pretty much to try anything
Right.
in a sense, but um, I really think it's worth a try to, if you find somebody that has good credentials and help, that has history of helping people. I think it's something
And
that is worth giving a try.
obviously, if it's your CRPS doctor that's recommending them, then they must have a good experience. Well, thank
Yes.
you so much.
Thank you so much, Nancy. I think it's amazing that you're doing what you're doing.
Oh, thank you.